Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. You can talk directly with Dr. Darrow and get your free book. And that book is amazing. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, actually. And right now we're speaking with Russell in Montebello.
Hey, Russell, Dr. Marc Darrow. We were talking about your wife being told that she needs a knee replacement. And it's possible it may be good for her. It's possible it may be terrible for her. I don't have the answer for that just talking to you. But I do want to get some more information. First of all, for those of you just tuning in, if you can hang with me, Russ, the work that I do is called regenerative medicine. And what we do is use your platelets from your blood to inject. So it's a very simple procedure. Just do a blood draw, and then we can spin it in a centrifuge, get rid of the red cells. We never want to put red cells into a knee because of the synovial lining. It would blow up like a balloon, and then you have what's called an effusion full of fluid, and you don't want that. So we spin it, and the red cells are heavier than the platelets, and they go to the bottom of the test tube. We take the platelets from the top and we inject it right then. I use an ultrasound to guide the needle. Otherwise, the injection doesn't always get into the joint. The studies, and there's some in my book, show that if you don't use an ultrasound-guided procedure, you're going to miss the joint about 1/3 of the time, which is kind of dumb not to use an ultrasound. They're easy to use. Unfortunately, most doctors don't use an ultrasound. And, my opinion of doctors, even though I am one, is that most of them are what I call dinosaurs. They learn what they learn in med school and internship and residency, and then that's it. They stick to the format of the tradition that they grow up in. And I think in order to be a really good doc, you've got to keep growing your intellectual capacity, your procedure capacity. And even though what I do now is platelets and stem cells for healing the body, if something new shows up this afternoon, I'll be one of the first people to learn it and use it. I usually try it out on myself first before I give it to patients. So I mentioned the platelets, and then there's an even more what I'll call powerful or effective treatment that's using your bone marrow. Another very simple procedure where we numb up the area in the back of the pelvis called the PSIS, posterior superior iliac spine, and then we put a needle just into the pelvis there and then aspirate out the bone marrow, and then we can inject that into areas. That also has platelets in it because the bones make the bone marrow makes the blood and the stem cells. So let's get back to your... Nita, are you typing this whole time? I can't hear this clicking. Let's get back to Russell with your wife's knee.
Okay,
and
let's do it.
How long has that been bothering her, Russell?
It's been a number of years, and because of that one knee that's bad, the other knee is giving out.
That makes sense. Yeah.
She is obviously afraid of surgery. So
yeah.
My question to you, in your practice, do you prefer ultrasound or MRI, or does that question make any sense?
Yeah, it makes a lot of sense, and thank you for asking it. It's different. You can't inject really during MRI. We don't use MRI for injections, really. We use the ultrasound for injections. So the ultrasound is portable. I have 3 of them in my office. We roll them from room to room and wherever the patient is. And then it's a live image. So wherever I put that ultrasound, if it's on your shoulder or your knee or your hip or whatever, we're actually watching it live. We're watching it move, and then I can see what's going on inside with the examination. I can see if there's fluid in there. I can see if there's tears or whatever it is. And then, importantly, is when I do the injection, I can see the needle moving inside the body. And I can see that it goes to the exact spot that I want it to go to. Without an ultrasound, you cannot do that.
In a sense, you wouldn't even need the MRI, in a sense.
For some things, but MRIs are better than ultrasound for a lot of things. So I do get MRIs, yes. And sometimes X-rays are fine. It just depends. It's all different depending on what's going on with the person, what body part it is. So let me ask a couple questions about your wife. Can she walk?
Yes, but she's kind of limping, of course.
She's limping. Okay, yeah, that makes sense. And
yeah,
another
and
question.
I've been wanting to go to the doctor and see what we can do. She did have an MRI 2 years ago.
Sure.
But obviously nothing happened with that.
Okay. So is by any chance?
Go ahead, sir.
No, go ahead. You can talk.
No. MRI did show that she needs a complete knee replacement.
Okay, so you just said something that's the $1 million. What should I put it as? The $1 million confusion. Okay. You said the MRI shows that she needs a knee replacement. MRIs don't show that people need knee replacements unless the joint is completely destroyed, crushed, has a bone infection that's destroyed it. I mean, there's a lot of things where people do need joint replacements. But MRIs generally, for someone who's walking around, don't say, hey, you need a knee replacement. It's the doctor who says it. Okay?
So that would be more ultrasound then?
No. Nothing determines it except the examination. The physical examination determines that.
Okay.
You don't ask an MRI what to do. You look at it for additional information, but the exam is what counts. The exam includes the history of, how does the patient feel? What can they do? I just had a woman come in, I think it was just yesterday or the day before, and she said she had a workers' comp case. She was injured on the job. And she said her doctor says she needs a hip replacement. I examined her and I said, why? You have zero pain. I said, walk around. She walked around. She was barely limping. I'm not even sure she was limping. But the MRI showed that she needed a hip replacement. The X-ray showed she needs a hip replacement.
Pain, My wife does
What's
have
that?
pain while she's walking.
No, I understand that. I get it. But she needs to be examined to find out whether using platelets or stem cells or both together, we can help her get rid of the pain and make her happy. Okay. I don't have the answer over the radio by what you're telling me, and it's not the MRI that tells the doctor that a person needs a surgery. That's the doctor's culture that's telling him that. I cannot tell you how many thousands and thousands of people I've seen over the last 20 plus years who have been told they need a surgery, who never had to have a surgery. We get callers almost every week that tell that story, where they call up and they go, my doctor told me 10 years ago I needed surgery. I'm fine now. I never had the surgery. Why get a surgery when you can get infected? It can come out worse. When people do a surgery, when doctors do a surgery, let's say on a knee, a cleanup, you have immediate arthritis afterwards. Immediate. Okay. Because tissue is taken out. Is this making sense,
I'll
Russ?
talk to my wife about and see what we can do, and maybe take a few steps forward. And I'll tell her that I spoke to you and your approach.
Look, before anybody gets a surgery, unless it's an emergency, if you have an emergency, go get the surgery, right?
Yeah.
The bone is sticking out of the leg or something like that. But if you're okay, it's not a rush, you know? And there is time to check with a doc like myself who does regenerative medicine using platelets or stem cells to regrow the tissue and hopefully heal it. It's why are you going to do something that's not conservative? Do the conservative things in medicine first.
Okay. Well, I thank you kindly for your time, sir. And,
yeah. And something that people don't know is, in the studies that we look at, the number 1 and number 2 causes of death are heart disease and cancer, right? But you'll never guess what the number 3 cause of death is. Tell me what you think it might be, Russell.
Okay, sir. Thank you kindly for your help.
Nita, thank you very much for calling.
I know what
Nita,
it is.
do you know what it is? Tell us. What is it?
It's iatrogenic, which means caused by the doctor, the medication, the hospital personnel, or whatever. But it's basically a medical mistake.
It doesn't even have to be a mistake, unless you call going into a hospital a mistake, which I do. I don't ever want to go in a hospital. Hospitals carry infections. You have no clue the number of patients I've had who were not that bad off, whatever they went into the hospital for, and come out with a lifelong infection. Okay?
Well, we had a call about 2 years ago, Christmas time, from a woman that lost her husband ultimately because...
Oh, Catherine.
Yeah, remember
Kathy,
that?
yeah, I do.
Kathy, yeah.
I do. It was about 2 or 3 years ago. Yeah, I remember she called up and she was bawling her eyes out saying, Dr. Darrow, what happened? My husband came out of a neck surgery on a ventilator. And I said, well, I'm really not the guy to ask. You need to ask the surgeon. And she said, the surgeon came out after the surgery. I was in the waiting room. He came out and he said, I did it all right, and walked away. And that's her answer.
Oh, my gosh. No compassion there.
Well,
we were both crying on that call.
Yeah, we were. And it gets me all emotionally worked up just thinking about it now.
Yeah, me too.
That was not a good one. I'm not trying to imply that surgeries are bad. I'm just saying the ones that I see, obviously people come to me after they had a bad surgery, so I see the bad ones. But there's a lot of them. There's a lot of them. And why do something like that if you don't need to? Be conservative. Always be conservative in medicine. Do the things that have the least potential side effects. Hey, let's go to Jim. He's been waiting. Jim, Dr. Marc Darrow, what's going on with you today?
Hi, Jim. Are you there?
Oh, yeah, I'm here. I'm sorry I didn't hear that.
You're
That's
on
okay.
the air.
Yeah, actually, can you hear me okay?
Yeah, we hear you great.
Perfect, yeah.
Oh, perfect. Okay. Yeah, actually, I think I had a bad connection. I was driving when I called in. I was actually calling for my sister-in-law, not for me. She had a injury playing ice hockey. She plays roller hockey and ice hockey. And she went to the doctor. There was a lot of swelling, so they told her to wait and get an MRI. She got the MRI, I want to say like 2 or 3 weeks ago, and met with the doctor, and he suggested surgery. So she was diagnosed with a minor tear in her meniscus and a minor tear in her ACL.
Okay.
And the first doctor recommended surgery. He said you could probably try therapy, but my opinion is you'll heal faster if we do the surgery. So she went to get a second opinion. She was kind of leaning towards the surgery because she thought it would be, quicker to get her, back up and going. And the second doctor said he recommends just physical therapy. He said it would probably heal on its own. But he mentioned something like, 6 to 8 weeks of physical therapy. So my question is, she is going to go with the physical therapy.
Okay.
Would your treatment help her get through that quicker?
I'm not going to promise, but the answer is yes.
Okay, that sounds good. Yeah, I listen to your show. Whenever I'm working on Saturdays, I'm on my way into the office. I've heard a lot of success stories.
Thank you. I appreciate that.
I would love to.
May I expound on my
I'm sorry?
May I expound on my medical opinion on what you've told me so far?
I'm
answer's
sorry.
yes.
I
Okay,
don't know if
you're
I might be
cracking up.
breaking up.
Okay, no problem. I'm going to give you some information now if you want to listen.
Yes,
First
go
of
ahead.
all the studies that I've read say if you have, even if it was an ACL rupture, that means complete rupture, you don't do a surgery for 3 months, okay?
Oh,
Because
okay.
many elite athletes, pro athletes, don't even have ACLs. They've been torn, and they can do their sport perfectly. They don't know the difference.
Okay.
All right?
Okay.
So whoever that first surgeon is very aggressive. God bless him. I love him. You know, I love everybody, but that's not the way I would go. Your sister's knee is probably going to heal fine. If we put some stem cells in her, platelets in her, both in it, she's probably going to get better faster because they'll bring more healing to the area. So number one, when you have, even if it were a real ACL tear, hers is not. She has probably, Jim, had the minor meniscal tear and the minor ACL tear there for years. Okay?
Oh, okay.
For years. She's a rampant high-level athlete if she's doing ice hockey and roller hockey, and this is not the first time she's injured her knee. I'm sorry.
No, that's probably true, yeah.
Her knee has been injured every day she's done her sport.
Okay.
To some minor degree, right?
Right.
So just because she had a little tweak this time and it swelled up means nothing to me in terms of I'm not concerned. The first thing she needs to do, in my book, is she needs to get looked at with an ultrasound to see if there's fluid in the knee. If there is, and you're saying it's swollen, that needs to come out immediately.
Okay.
Then the knee can heal quick.
Okay.
It can't be done properly without an ultrasound because the way that I see the surgeons do it is blind and it's painful. The way I do it you don't even feel it. I numb up the area. I know exactly where every drop of that fluid is. I don't need to be poking a needle all over the place hoping I'm going to strike oil. Do you understand that?
Okay. Yeah.
I don't know why the orthopods are not compelled to use ultrasound. They don't think they need it. But honestly, I didn't think I needed it either when I first learned years and years ago how to do it. The only continuing education that I really do is with cadavers and ultrasound. I do that every year a couple times where I spend several days learning my skills with ultrasound. It is the most important thing if you're going to be injecting into the body. Okay? You need to know where that needle is going. So number one, in my book, I'm not telling you what to do or telling your sister what to do. If she were my patient, she isn't. If she were, I would look with the ultrasound. If there's any fluid in there, I'm going to take it right out. In 2 seconds, she would say, I feel better, thank you. That might be all she needs.
Wow.
Now, I get people all the time who come in with complete ACL tears. Every sport. Their knee is full of blood. I aspirate out the blood, and guess what? None of them have ever had an ACL repair that I can remember, not one. They didn't need the surgery. Now, it is possible that someone with an ACL tear needs a surgery. If that knee is flopping around and it's loose, then you need the surgery. But you have to be careful after that surgery because it's a 9-month rehab minimum, and a lot of them tear during that period. So you put in the graft, you take a cadaver graft or a medial patellar tendon graft or a hamstring graft, and you put it in there, and then they rip again. So I'm not a lover of that ACL surgery unless the knee really is loose.
Yeah. She's actually walking pretty well with a brace. It's obviously not healed yet, but
yeah. Well, it's a brand new injury. My God. Yeah. Even if it was, hey, look, even if it's something simple like a sprained ankle, it hurts.
Right.
If you have a sprained ankle, do you get a surgery on it? No. So why would a sprained knee get a surgery?
Right.
It just doesn't make sense.
Well, they do say
the surgical culture,
like you said,
the surgical culture makes zero sense to me, in my experience as a doctor. Okay.
Okay.
I'm not saying surgeries are not necessary. They are necessary, but not to the extent that they're being done. I'm going to put out a ridiculous number that I'm making up that is not founded. I'm going to say 99% of these surgeries should not be done.
Wow. Okay.
Just the fact that a surgeon told the first doctor said, let's operate it, you'll heal faster, makes no sense to me.
Okay. Yeah, that's what I was hoping for. And luckily she's decided against the surgery, but I just wanted to see if there's a way for her to maybe recuperate a little bit faster. They did
I think so.
It's would heal on its own, but the ACL, they just said that it could take 6 to 8 weeks of physical therapy.
Well, again, please hear this, Jim. The things they see in the MRI may have been there for 10 years. It may not be the culprit.
Right.
So why go fix something that's not the problem?
Sense.
My mom, who was very wise, used to say to me, Mark, if it ain't broken, don't fix it.
Okay. And next, one other quick question.
Sure.
She has pretty good health insurance. Would they cover any of that, any of your treatment?
You know, in terms of issues about that, you have to call the office at 800-300-9300.
I wrote it down. I'll have it.
I know, but everybody else doesn't.
Oh, I'm
There's a
sorry.
lot of people shifting radio stations, so it's for them too.
Yeah, good.
The number to the office to get more information is 800-300-9300. And I would love to get some callers into the show right now to talk to me live. It's 866-870-5752. You get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with a foreword by Suzanne Summers. And that'll go to you free. I send out a ton of books free every day. And I want to educate people how they can save themselves from surgery they never needed in the first place. It's a new paradigm of medicine, I know that, but it's not new for me. I've been doing this my entire medical practice with amazing success. It doesn't work on everybody for various reasons. I'm going to tell you what some of the reasons are. People get the treatment, then they stay active. You got to let it heal. If you get a surgery, you're not going to go running a marathon afterwards or go play golf afterwards. You got to let it heal. Some people take anti-inflammatory medicines. We need the inflammation. When God made our body and your sister's knee swelled, it was done for a reason. We got to go to the website, www.lastemcells.com. You can watch videos of me doing the procedures. You can email me from there. If you want to call the office, it's 800-300-9300. Thank you, Nita Valens. Thank you, Suzette and Alex and the whole crew. God bless you all.
And we will see you next time.
Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.